The Stephen Handyside Show is sponsored by BMI Healthcare, Neostrada Skincare, New Skin and Body Face Couture.
Welcome to the Stephen Handyside's Ultimate Beauty Show. Step inside my ultimate beauty clinic and discover a world where the very best aesthetic, beauty and fitness experts will be demonstrating to you just what can be achieved, whether you want to look younger, change your image, get fitter or sleep better. Now, coming up on the show, we find out how to smile more confidently in photos, how fat can be painlessly frozen away to reveal a more contoured and toned body, as well as some time-saving fitness tips which you can do at home. There is something for everyone, so let's have a look. Here we are inside the Ultimate Cosmetic Clinic. This is where all the action happens. If you haven't had a cosmetic treatment before or you are considering it, then you're going to love this part of the show. Now, first up, I have Dr. Raina Zabadawi, and you're currently doing a skin peel, is that right?
That's right, Steve. I'm doing a Neostrata skin peel, whereby I'm putting a 50% glycolic acid peel on Teresa's face. This is more of a preventative measure and part of her ongoing skincare treatment for anti-aging, to prevent the skin from aging.
Great, and how many treatments would a typical patient need?
Skincare is always ongoing. There isn't an amount. What happens is we always need to have preventative skincare and skincare which treats the skin. Now, generally, what we treat is hyperpigmentation, aging, fine lines and wrinkles, and open pores. What a skin peel does is, if done at intervals of 4 to 6 weeks, it's as though you're pressing on the accelerator of skin peel and helping the skin cells shed a little bit faster, so that the active part of the skin, which is the dermis, regenerates in a uniform way.
Normally when you have a chemical peel, you can't go out. You hide. So you were saying that with this, you're not getting all that flaking, that's what makes this particular one unique.
Exactly. With the Neostrata skincare, what happens is it's tailored more towards the patient's lifestyle. Yes, the skin cells do shed, but more at a cellular level, at an individual cellular level, so you don't get that irritant redness, and you don't get that flaking in sheets of skin. So in actual fact, the patient can go to work straight away.
To work and come home.
If she had to stand in a corner on a black sheet for a week and collect the amount of skin cells that she'll shed, she'll find she'll have shed about 3 big spoons of cells.
Great. Well, I think I can't wait to see the results. So great. Thank you very much. We'll move on to the next one.
Thank you.
Hi, Gabriella Mirchik. What are we doing here?
We have beauty facelift by threading.
Okay.
And magic serum with special advanced molecular mask as an aftercare.
Great. Okay.
I will show you how we can do it. Yeah?
Show us how the operation goes.
This is so interesting.
Small needles. And we will do like snake to catch all tissue, but normally it's dropping down, and ladies, they don't like this. Done.
Great. So how many injections would you typically do?
Will be 5 long needles and 5 short ones.
And it's just going to have an instant lift? I mean, is the effect quicker than, say, if you went and had surgery? There's no downtime?
It can be a little bit of bruises, but after 5 days, everything come back to normal, and you can cover by makeup next day, you can come back to work.
Is there patients that are not typical for this type of procedure?
Is treatment for everyone.
You said that you could actually do under the eyes, you could change all kinds of...
Full face.
With no surgery anymore.
No surgery.
That's crazy.
non-invasive facelift.
She's been looking at my face the whole time. I know,
I'm sure she
she's
doesn't
like,
mean
I
that.
can so fix that face.
I can help.
So today you're actually just doing it around the lower jaw area?
Just jawline
great.
to lift the skin, and patient will see a good result after 12 weeks. Threads, they stay under the skin for another 6-8 months, and they work. They create new collagen, and this new collagen tight the skin and make lifting.
Great. Well, we're going to come back and see the final results.
Okay.
Great. Thank you.
What have we got here?
Now, Sia Nifrandareski, so you are doing the Enlighten Whitening treatment, is that correct?
I am indeed.
Okay.
It's a very novel treatment in the sense of its ease of use, its practicality, and a very straightforward instruction for patients, and the fact that they need to wear these trays, which is a very low concentration, steady uptake of the actual bleaching trays, and the patient needs to wear it for 2 weeks to get the most optimum guaranteed results. And that's what's the beauty about this, in the sense that not only is it a guaranteed result, the whitening works, and there's also a very straightforward, simple maintenance program to ensure that you don't just get a whitening result as a quick fix, but it also lasts and is maintained.
Great, and you've got Annie here. She's had the treatment?
She's had the treatment.
Okay.
She's been using the trays, I believe, for a couple of weeks, and we've managed to get to this wonderful B1 result. If you want to smile for us, Annie.
Yeah, we'd love to see how it works. They look great, huh? Do you love it?
I love it. It's very good.
Do you want to show us how the actual tray works, Annie?
And as you're explaining, you were saying to me that a lot of times the fact that this fits so uniquely and that normally it won't cause the problems even if you have it on for 2 weeks or you have it on overnight?
Indeed. The way that the actual tray is designed and the way that the gel arrives in a cold, fulfilled manner, it allows the minimum sensitivity. You don't tend to get the usual issues regarding sensitivity which most gels tend to have. It also allows a very slow uptake, and the design of the tray allows for the gel not to actually spill out of the tray and the saliva to get in, so therefore you tend to get that great result from the neck of the tooth right down to the tip, which is a uniform white result, which is what patients are really looking for.
And what about the regression?
The
That's
regression
big
is a
thing.
big question, because a lot of patients will go and have teeth whitening as a quick fix stop, but then 2 or 3 months down the line they'll come back to your practice and they're not as impressive. The beauty about this treatment is it will rely on very straightforward patient compliance to wear it for a couple of weeks, and they need to maintain it by wearing the tray for 1 night every other month.
That's
I have
amazing.
some patients that insist on wearing it once a month, but that's down to the actual patient's preference. So the maintenance becomes much more affordable, and the actual result is much more maintained.
Now, see, I've had teeth whitening done on a different system, but especially for men, I don't know why, but I always struggle to remember to use the retainers and top up. But I was quite sensitive. Does it depend on what patient is having the whitening, whether your teeth are going to be more sensitive?
I
than
think
others?
there's about a 90% group of patients that tend to have minimal issues. If you're outside that bracket, it's very important for patients to have gone to a proper dental practice. They need to have a full assessment by a dental practitioner to ensure that if there's going to be any issues, so those are then looked at and dealt with appropriately.
It
Great,
looks
I mean,
amazing, yeah.
you would love some
I
more
know,
whitening.
I
We
know.
all
I
like
want every
some more
single
whitening.
one of these treatments.
That's brilliant. Thank you so much for that.
Okay, thank you.
Right, we'll go back to see the final results with Gabriella.
Okay.
So, Gabriella, are we able to see the final results now with the patient?
Yeah, you can ask patient to show. We
Does it
lifted
hurt?
the jawline.
Do you feel it?
Did it?
Nothing. That's
Patient had before
touch it?
EMLA cream, yeah.
so you
Okay,
don't
great.
feel those.
No, completely.
Great. So, can we get a
Okay.
final shot with on screen?
Yeah.
Great. So we can obviously see, the results from it. It's very instant, isn't it?
Yeah.
Typically, how much swelling? How long does this swelling take to?
You can see
subside?
that this lady, she can come back to work today, really, after lunchtime.
And you
Great.
said it will bruise up a bit.
Sometimes happen that is no one bruise, if I am lucky.
Yeah. And that might
Fantastic.
depend on the other person, their sensitivity, to whether
Yeah,
they're bruised
true.
or not. So-
And condition of skin is very important. That's why always after the threading, I apply special face mask with drop of
What does
magic
that do?
serum. This hydrate the skin for 72 hours and do some lifting.
Do you leave this on her skin?
Yes.
For the 72 hours? So you
No,
actually,
no, you use for 20 minutes.
Oh, 20 minutes, sorry.
And hydration is 72
okay.
hours. That means when you travel, when you can't use any cream, you can apply before you go and you are safe.
Wow.
Well, it's great to see some fantastic treatments from some of the leading experts in the UK. On the Stephen Hattey Side Show, we love to bring you the ultimate patient transformations. Now I have with me cosmetic dentist Dr. Rahul Doshi, and we're going to be looking at the Smile Makeover. Now I've got some interesting statistics here from the AACD survey that say 76% of people don't feel confident to smile in a photograph, but this is the one I love. 67% of people think it helps romantically. Hasn't helped me out, but what do you think of those stats?
Oh, do you know what? It's so true. I have patients who come to me once they're separating or they're divorcing, and the one thing that they attribute finding a new partner is their new smile. And they say that that's really helped them actually attract people to them.
Oh my God, that's amazing. Well, in terms of what we've got here, you've sent in a particular sort of three-step process of that people can expect in terms of their smile makeover. So if you just walk me through each step.
Okay, so when a patient comes in, they want to have a smile that they perceive in their mind that they want. And our objective is to try and create that. So this patient may want a natural smile. So what I want to do for all my patients is to actually hand make and hand create a trial smile that they can go home with, and they can look at and critique, comment, so that they can come back to the practice. We can then get their feedback and modify according to what they want. Most patients don't know what they want until they try it. It's like clothes. And
so this is
the trial smile that we hand created.
Okay.
And the patient would have gone home, looked at that for a week or so, and then given us some feedback, because this smile is going to be with them for many, many years of their life, and they want to make sure they've got it spot on.
And this is the final result here. I mean, that is such a huge difference.
Well, the patient went back home with a trial smile, a natural smile, and she came back and said to me, they loved the shape and the size that I created, but they wanted to go whiter and glossier. Now, they didn't know that until they tried that smile out. And then this is the final smile reflecting the shape, the size that we had originally, but the whiteness and the glossiness that they wanted.
Okay, so I want to look at two case studies here. Now, this guy, I mean, he just looks a different person. I mean, tell us a little bit about this gentleman.
This is Christian. Christian came to us because he actually wanted to meet young women.
Okay.
He was very self-conscious about the gaps between his teeth and the discolored teeth, and they actually sort of stuck forward as well.
Yep.
We transformed his smile, and you can actually see his eyes light up.
It does, yeah.
So if you look at we've got the same hairstyle, you can't see the hair too much. He's wearing the same white shirt, but the big difference is his new smile. Okay,
this is my favourite. Is this a girl that's obviously had something before her big wedding day?
Yes, this is Leanne, and Leanne was very self-conscious about her wedding day, the big day, when there are going to be lights and cameras on her. She was paranoid about her crooked teeth.
Yeah.
So she came over, we did a smile makeover for her, and you can see how stunning she looks on her wedding day.
And that must be quite a popular thing for people before their big wedding day. They want to have their teeth fixed, whether it's a big smile transformation or you know, something just, you know, getting their fillings fixed, I presume.
Absolutely. It's a big thing, because now with high definition cameras, people want to have nice photos, and they want to look at them and actually have all the small sort of irregularities ironed out.
Great, well thank you so much for that, and if you want to find out any more information about smile makers, go on to myfacemybody.com and Dr. Dosh will be there to answer any questions.
Welcome, I'm Danielle Lynn, and I'm here with Dr. Amar Khan from the Harley Street Skin Clinic, and we're talking about anti-aging. And there's so much in this short period of time. You were saying something to me about the history of what happened in skincare and where we are today. Can you just go over that a bit?
Yeah, sure, Danielle. Back in the 80s, we were using human growth factors, but they were coming from placenta. And this is the afterbirth, and they were going off to the companies to be used in cosmetics. In the late 80s, there was a Human Tissue Act, which stopped all that. So that stopped all the active ingredients going into something like Pond's cream.
And we were talking about that. With every grandmother, they took Pond's cream, and they had great skin, and everybody wondered what happened. So they took those factors out, and now where are we? Have we made a progress to come back from that?
Well, science has progressed over the last 30 years to take us back to where we were then. And the ingredients that we're using now are active. So
Okay.
we've synthesized
So
human
could it
growth
be
factors.
a plant botanicals and things? So when we go through this, like we're standing in a bar, it doesn't make much sense when it comes to great skin, but the idea here is how do we create a skin cocktail? When we go, or I as a woman go and I look at products, what do I need to see in these products? What am I looking for on that label? A couple of the ingredients.
Sure. I think one of the things that's important is to turn over the skin and get rid of the dead skin, which looks dull and old. And AHAs, alpha hydroxy acids, and polyhydroxy acids are very good for that. The second thing to look for are nourishing factors, so growth factors, and peptides are very, very good. And the third thing to look for is an antioxidant which protects the skin.
So when you're spinning, you're looking at the labels, like you take a product like this and you say to yourself, I'm going to turn it around, I'm going to look on the label, and I'm going to look to see if it has the ingredients most important, not just necessarily a famous brand name. And they will be more effective. I know you mentioned when we were talking earlier about the idea that they may be expensive.
Yeah, absolutely. And that's down to the research that goes behind them now. You know, products are becoming more scientifically produced. For example, this product here is a stem cell based product, which is based on a patented stem cell which has research behind it. So there's lots of science behind that. That costs a lot of money, so that has to be recouped in the cost of the product.
Yeah, so the idea is that it may be expensive, but you want it to be effective. So if you're going to look for a product, and if you want more information, go to myfacemybody.com, because that's where you start. When you know what you're looking for, because you have education, it'll make a difference in your life. So good to have you here. Thanks for being with us.
It's been a pleasure.
I'm here with Paul Marr, fitness trainer from Lean and Mean Project. Welcome to the show, Paul.
Thanks for having me here.
Now, you're all about these boot camps. I see them all over London. I mean, what are the benefits of going to one of these boot camps?
Okay, so yeah, these boot camps are designed for busy people who want to achieve results and get in shape fast, as well as learn how to eat healthy and maintain their body.
Great. So today you're going to show us a few little exercises which we can do at home, we can do in the park, or what you'd be doing typically in a boot camp. Is that right?
Yes, that's true. I'm going to show you some effective and short exercises which you can do anywhere. You don't need any equipment.
So what's the first thing you're going to show us?
Yeah, we're going to start with a few core exercises, okay, because core is really important, not only for aesthetics, but as well to prevent your body from injuries. Okay, if you have strong body, you're going to connect your upper and lower extremities.
Okay, so what's the, I mean, I've got no one else to demonstrate this, so I'm going to have to be a guinea pig. So what's the first exercise?
Cool, let's do this. We're going to start with plank. Okay, so we're going to get on the floor in a plank position. And we're just going to hold plank, okay? And to make this exercise a little bit harder, we're going to start moving up and down on your arms. Okay, let's go, Steven. Okay, make sure you're keeping your core tight. Okay, that would be more advanced version of normal plank. Keep going, Steven. And let's stay here in this position. Lift yourself up, and we're going to continue with mountain climbers. So you're going to be driving your right knee to your left elbow. Okay, and make sure that your core is tight and you're synchronizing breathing and movement. Okay, how are you feeling? Perfect, and let's go back in a plank position. Okay, and this is the last exercise. From here, you're gonna tuck your core in and you're gonna raise your hips up. Okay, and control down and up again. Control down, and you can stand up, Steven.
Oh, is that it?
Yeah, how are you feeling?
Knackered. Knackered. So is that all for the session, or?
No, that's just the beginning. Okay, we just activated your core.
Okay.
And now we're gonna start with a full workout.
Wow.
Yeah?
Okay, let's go.
You ready to go?
Yes.
Cool, so we're gonna start with lunges. We're gonna lunge forward. Okay, let's do that.
Like this?
You're gonna step forward, keep your shoulders back, and perfect. Okay, try to have a bit longer step, and now we're gonna switch to jumping, right? So we're gonna step forward, and you're gonna jump and switch. Okay, this will be harder exercise of lunge. Okay, keep going, Steven. Okay, and let's go down in a push-up position.
Okay.
Perfect. So push-up, another great exercise for upper body. Very good. Okay, let's keep going, Steven, a little bit faster. And now add your knee towards your elbow to get your core involved. Perfect.
I'm not liking
Keep going. Couple more, Steven. Okay, and from here we're gonna stand up and continue with everyone's favorite exercise, burpees.
Oh, lovely.
Let's do that. Okay, and to make this exercise more fun, you can add squat jump. Let's try and do that. How are you feeling, Steven?
Not good.
Okay, let's go for another burpee. Okay, and one more time. Perfect.
Paul, I think I've had enough, mate. Gotta leave the rest up to you.
The Stephen Handyside Show is sponsored by BMI Healthcare, Neostrata Skincare, New Skin and Body Face Couture.
The Ultimate Beauty Show is all about being open and honest with your health and beauty issues. Today I've got two of the UK's leading experts around two different areas. I've got Dr. Jag Chana and Dr. Rika Taylor. Thank you very much for coming in. I'm going to start with you, Rika. Now, obviously in the guide you have written an article about fat freezing, which sounds pretty amazing. So can you just tell us a little bit about what this technology is?
Okay. The technology, this particular technology is called cool sculpting. It's quite an unusual technology, originally developed by Harvard scientists when they noticed that children who were sucking a lot of ice lollies, they noticed that they were developing fat loss in their cheeks, so they were developing dimples, and they then harnessed this idea and developed this machine. So basically the machine is very good for treating people who are within 2 stones of their ideal weight and have got pockets of pinchable soft fat. And the machine has an applicator which sucks up pockets of fat and puts the fat is then between 2 cooling plates, and the fat cells get frozen.
So it's not a weight loss treatment at all?
It's not a weight loss treatment.
No, so it's really just targeting those fatty deposits.
Yes.
We did have a question on social media from Tim, and he was saying that can this treatment be used for a man? Is it possible?
Yes, it's suitable for men and women and all races.
Great. It's just a bit more painful for men usually. It's would you agree, Mr. Chana?
Well, often the pain threshold can vary slightly between male and female patient. One often finds that men are just a little bit more sensitive.
Yes, I know. I'm a wimp myself. What, in terms of how many sessions would someone need to come in?
You can have as little as 1 session, and 1 session would give a 25 to 40% improvement of the area. But obviously, if you want more of an improvement, you can stack treatments, so you can have more treatments in the same area.
Because that's quite amazing. Because I've seen, in terms of a lot of other sort of treatments like radio frequency and ultrasound, you need to have quite a number of series of treatments, and it does get quite expensive, I think, for people that are wanting, to think about having cosmetic treatments. So this sounds like a good option. I've got another question from Jane Smith from Leeds, and she says, how many treatments would I need to have to see results if I was sort of targeting areas around the thigh area?
Even 1 treatment,
Just,
even 1 treatment. But if you want a more wow result, then you could have more than 1 treatment in the same area.
I mean, I think in terms of the Ultimate Beauty Guide, I think one of the things we were trying to get across is having experts like yourself that are doing safe treatments. I think consumers are really worried about that.
The safety thing is really important, because obviously if there isn't a safety mechanism to monitor skin temperature, then it can cause damage to the skin. And this particular machine has a mechanism on it to detect the temperature of the skin. It's called Freeze Detect.
Okay. Oh, fantastic. Well, it sounds amazing. I'll have to try it at some point.
Please come.
Yeah, no, I will. So over to you, Mr. Chana. You're obviously doing something different. You're a plastic reconstructive and cosmetic surgeon.
That's correct.
And in the guide, what you've covered is around facelifts.
That's correct.
About aging and about how sort of facelifts can be a fantastic solution. Can you just tell us a little bit more sort of about what you sort of focused on in the article?
Well, basically, facelift surgery encompasses a multitude of techniques, and it's really about individualizing the procedure to actually suit each individual patient that comes to see you. And it's not just one operation that would suit every particular person. And if you actually read about these kinds of procedures on the internet or in the media, there are so many different types of nomenclatures and different types of procedures, and it can be really confusing. I think the most important factor is to see an experienced surgeon, and they will just address those factors that are of a concern to you as an individual, and then choose the right technique.
I mean, I always thought with a facelift procedure, it's for more targeted towards maybe women or men in their sort of late 50s and 60s. Is this true, or is it for younger people?
Well, facelift surgery can be addressed even from 40s onwards, and we're seeing a rapid rise in mini facelift procedures, for example. I think there's a huge generation of patients coming through now that have been very used to non-surgical treatments and are reaching the age in their 40s and 50s where they're finding that actually, you know, these non-surgical treatments aren't just providing, aren't providing the improvement that they would hope for, and so they're turning to surgery to see what's the next step in terms of their facial rejuvenation.
And do you combine sort of non-surgical treatments with a surgical treatment? So if someone has lost volume in the cheeks, does a facelift correct that, or is that just tightening the skin?
Well, it's interesting you say that, because modern thinking about facial aging does encompass a number of factors. It's not just the skin and soft tissues that become lax with age. If you actually think about the aged face, there's quite a lot of loss of volume. So modern facelift surgery will involve restoring that volume. And we don't often use so much in terms of non-surgical techniques, but I tend to use fat transfer in combination with facelift surgery.
So using someone's own fat?
Someone's own fat, yeah, absolutely.
I always like the theory behind that. You take fat from an area you don't want it, and then you can re-inject it back into places you need it.
Absolutely.
So I've got two questions here. One is from Melanie Irish from York. She says, are there any certificates or diplomas that my doctor, that I should, when I'm considering and having a procedure, is there any qualifications that specifically I should be looking for?
Well, of course. I mean, I think you should be seeing a fully qualified plastic surgeon, and most surgeons who are fully qualified will have the FRCS Plast degree and those letters after their name. But moreover, I think they should belong to the British Association of Aesthetic Plastic Surgeons. It's a body of surgeons in the UK, and it's the only body, in fact, that audits the safety figures of all their surgeons. So every year these figures are compiled by the association, and I think that gives the public some level of security in terms of the fact that they're seeing somebody from a credible association.
Just one last question was, and this is something that I've always been intrigued with, is the wind tunnel effect. And Alice is worried that, she said, I'm interested in having the procedure done, but am I going to have that wind tunnel effect?
Well, I get asked this all the time.
I'm sure.
All the time. And I think I often say that, if a facelift procedure is carried out incorrectly, or the vectors of pull are incorrect, then you can end up having that kind of appearance. And of course, a patient who looks like they've had a facelift is someone who often is not that attractive, because the facelift hasn't been carried out appropriately. And of course, the kind of results we're looking for is to achieve a result where a patient looks like they haven't had a facelift. It looks very natural.
Thank you so much for both of you coming in. If you want to find out more information about both specialists, pick up a copy of the Ultimate Beauty Guide and you can read their articles. Also, you can go onto myfacemybody.com and download your free copy there.
The Stephen Handyside Show is sponsored by BMI Healthcare, Neostrada Skincare, New Skin and Body Face Couture.